Hello, everyone. Thank you so much for joining today's webinar. My name is Renee Delacqua, and I'm a program manager at UC San Diego's Transportation Research and Education for Driving Safety Center, or TREDS. Before we begin, I would first like to extend our sincerest appreciation to the Federal Motor Carrier Safety Administration for making this event possible today. I would also like to thank our partners at the California Trucking Association for their continued involvement and support of programs such as these. So a few housekeeping items before we jump into today's webinar. We wanted to let you all know that participants have been muted upon entry. We have disabled the chat, and we kindly ask that you use the Q&A box, which is featured at the bottom of your screen, or the raise hand feature to ask questions. If you do use your raise hand feature, a member of our team will unmute you so that you can ask your question out loud. And one last thing is that today's session will be recorded. So before we jump into today's agenda, I first wanted to provide a brief background regarding this webinar event. So this event was originally intended to serve as a follow-up opportunity to those who attended the Just Drive Deliver Drug-Free Safety Summit, which took place on March 13th through 14th, 2024, here in San Diego. The summit addressed substance use trends among CMV drivers, model policies and programs, action planning for driver safety, and educational programs to reduce impaired driving. The summit brought together fleet safety leaders from across California, as well as CMV stakeholders from across the nation. We had an amazing lineup of speakers during the event, some of which are here today, as well as activities that aim to promote dialogue among peers and stakeholders. And the event also aimed to assist fleet leaders develop feasible strategies and solutions for addressing substance use and compliance within their company. Due to the success and the impact of that event, we decided that it would be important to extend the invitation for this follow-up opportunity to all CMV stakeholders in California. So today you'll be receiving industry updates and engage in interactive discussions with peers and other stakeholders. If you are interested in learning more about the Just Drive Deliver Drug-Free Safety Summit, or would like to review some of our recorded sessions, we will be dropping a link in the chat at the end of today's webinar that'll take you directly to an overview of the summit, as well as a link to the video recordings. We'll also include a link to that part of our website in a follow-up email. So without further ado, I would like to introduce Dr. Darren Grandel, Traffic Safety and Impaired Driving Advocate. Dr. Grandel will serve as today's webinar moderator, where he will summarize key points, solicit input from participants, and moderate discussions. A little background about Darren. He currently serves as the Senior Vice President of Traffic Safety and Government Relations for the Foundation for Advancing Alcohol Responsibility, and he is also the Director of the National Alliance to Stop Impaired Driving, or NACID. Darren previously served as the Director of the Washington Traffic Safety Commission from 2012 to 2020, and retired as a captain in 2017 from the Washington State Patrol after 25 years of service. Please give a warm welcome to our webinar moderator, Dr. Darren Grandel.
Well, thank you, Renee. Well, good morning and welcome to the Just Drive Deliver Drug-Free webinar hosted by the University of California, San Diego's Transportation Research and Education for Driving Safety, or TREDS. I know that's a mouthful, but welcome. We're excited to have all of you today, and truly it's an honor to serve as your moderator and to work truly with an amazing team with the University of California, San Diego. We have several on the call, but for the research that they've done, the amount of effort, the attention to detail, the collaborations that they've made with so many of you that are on this call and throughout California is really how do we actually address some of the challenges we have with substance use and impaired driving. you know, so I wanted to just give them a shout out. Thank you very much. And also to the Federal Motor Carrier Safety Administration for all of the work that they've done and provided the resources to help make this program available to all of you, as well as the California Trucking Association. I know has been a very strong partner throughout this whole thing. So thank you very much for all of you. So I just wanted to shout that out to begin with. So today we have a power-packed agenda with subject matter experts to address the critical threat of substance abuse and impaired driving on our roadways, which impacts your drivers and your fleets, your employees. I mean, we see it on our roadways, from just not only passenger vehicles, but motorcyclists. And we also see some of these challenges with our CMV operators. Now, please note, this is not an indictment on CMV operators, this webinar, but really to address issues and challenges that you face with impaired driving. How do we identify it? How do we address it once we have? How do we help with some of our hiring practices and those kind of things? So to kind of set the stage a little bit, I wanted to just share with you just some data. It's the most recent data, which is 2022 from the National Highway Traffic Safety Administration's Fatality Analysis Reporting System, just to kind of put this a little bit in context. So when you think about 4 out of 10, well, around 41% of drivers killed in motor vehicle crashes, they tested positive for both drugs and alcohol, including 33% who were drunk or driving drunk and then had drugs in their system. Now, as you might know, the presence alone does not necessarily mean impairment. But when you look at some of the data, it says additionally 14%, or about just shy of 4,000 of total driver fatalities in 2022 involved a driver who tested positive for cannabinoids, and 20%, or about 5,300, were positive for 2 or more impairing drugs. So when you think about one drug and the impairment that it's providing, you get that multiplicative effect. So this is kind of the data that we're seeing out there is 2 or more impairing drugs. Now, in 2022, among drivers tested, about 48%, or just about half of drivers killed in traffic crashes, had a blood alcohol concentration of a 0.01, just barely, or higher, and tested positive for cannabinoids. And they mix together and create all kinds of impairment issues. 40% of cannabinoid positive driver fatalities involved a drunk driver where their blood alcohol concentration was a 0.08 or above. Now, I highlight some of this because these are people that you're sharing the roads with. Now, and you might even say, well, we might even have some drivers that are mixing and matching some of these. Now, when I was thinking about this, in combination of this National Highway Traffic Safety Administration data, some investigations by the National Transportation Safety Board, where they've identified some of the causes in some of these crashes where the CMV operator was actually under the influence of a couple of different drugs, or maybe even prescription medications, or over-the-counter meds that they had mixed with other things. And then when you look at the Federal Motor Carrier Safety Administration's Drug and Alcohol Clearinghouse data, which you're going to hear more about in just a few minutes, kind of emphasizes the importance and the significance of today's webinar of addressing substance use and impaired driving in the commercial vehicle industry. Now, many of you may have been at the summit in March, and some of you may not. But kind of reflecting on that summit, the Just Drive, Deliver Drug-Free Summit, I was really impressed with the engagement, the focus of company representatives being proactive and kind of addressing drug driving and finding ways to enhance their own hiring practices, internal policies, training to identify substance use and impairment of those in safety-related functions in their organizations, and also the collaborations that they had, because you can learn a lot from each other, from this kind of what's happening out there, what you're seeing. And I know many of you have potentially been through the drug and alcohol training that you're required to under 382. But what's up and coming? What is happening? How do we help maintain that freshness of training for our officers? So today, as we go through the webinar and this little summit, we want to build on what happened in March and kind of expand this outreach to all of you and to many more to enhance CMV safety. There was a quote from a former California Highway Patrol commander and now a risk management guru. He says, if it's predictable, it's preventable. And I think you can all predict things as it can be preventable. So let's kind of take a look at some of the goals of the webinar today. Now, the goals here today are really to improve road safety by preventing drug-impaired driving within the CMV industry. And I think for many of you would say, I don't want that in my company at all. And so that's one of those things that we'll be focusing on. Also, to provide fleet safety leaders, all of you, with a unique opportunity to receive industry updates and engage in interactive opportunities to receive industry updates and engage in interactive discussions with peers and other stakeholders. So, when you may not be on the phone, be able to, have that face-to-face in this event, but you really have that opportunity to engage together. Because one thing I will just really emphasize is this is not something we can do alone. We have to work together. From industry side, from the government side, from other sides, safety advocacy, we've got to work together. So today, joining us this morning, we have a number of industry leaders from the California Highway Traffic, or the Trucking Association. We have Nick Chappie, who will be representing the CTA. From the Federal Motor Carrier Safety Administration, we have Dan Eakes, who's going to be from addressing the Drug and Alcohol Clearinghouse. And then Dan Horvath from the American Trucking Association. So we'll be introducing them in just a second, but just want to let you know they are going to be coming up as our panel. And I'd also like to just highlight here for many of you that are on this call is a lot of the California fleet representatives in attendance today. And so thank you for being involved, being engaged, because this is really very important work that we're doing. Now, this is not just a come and listen webinar. This is an interactive event where you'll have the opportunity to ask questions, exchange information, experiences, and ideas with one another. So before we get into the next step, I wanted to just kind of run through just the brief agenda and the timeline with you. So first we'll have, we've had our welcome. We're going to have Nick Chappie, who's going to speak to us, Devin Eakes, Dan Horvath from the American Trucking Association, and then we'll do a panel Q&A with them as well. And so you'll have an opportunity to either type in your question and answer in the box, or you can raise your hand. There's should be a little icon at the bottom of your thing that says raise hand. And so, and then we'll have kind of an open discussion. We'll close up with having kind of a Just Drive Deliver Drug-Free curriculum event, and then we'll have the closing remarks. So first, as our first speaker today, I'd like to introduce Nick Chappie, Director of Government and Regulatory Affairs, California Trucking Association, who has partnered with TREDS to bring you today's webinar. Nick?
Good morning, everybody, and thank you, Darren. As Darren mentioned, my name is Nick Chappie. I'm the Director of Government and Regulatory Affairs for the California Trucking Association. Thank you all for joining us for this opportunity to promote safety and prevent impaired driving. The California Trucking Association is committed to advancing roadway safety, and today's event is a testament to that mission. Here at CTA, safety is one of our core tenets. We're very proud to partner with UC San Diego TREDS Center to host this drug-free driving summit, as this partnership underscores our shared commitment to keeping our roads safe and free from devastating consequences of impaired driving. As the key operators of the goods movement industry, we understand that safe driving is not just about protecting our own drivers, but also about protecting everyone on the road. Drug-impaired driving endangers lives and threatens the safety of our communities, especially as we heard from Darren earlier about some of those statistics from the 2022 Fatality Analysis Report. At CTA, we believe education, awareness, and proactive measures are key to creating a culture of safety. Today's summit brings together experts, advocates, and industry leaders to share strategies and tools that can help us combat impaired driving, particularly within the sensitive roles drivers have in the goods movement industry. By working together, we can ensure that our roads remain safe, that our drivers remain drug-free, and that California continues to lead the way in roadway safety. I want to give a big thank you to UC San Diego TREDS for hosting this important summit, and thank you all for your continued dedication to safer and drug-free roads. As a quick little bit of a plug, CTA is hosting our Safety Council meeting, which is open to all next Thursday on September 12th. That program is going to be focusing on CHP's L Protector program. And you can sign up on CTA's event page on caltrucks.org, as well as a save the date on October 24th. CTA will host FMCSA to review the Drug and Alcohol Clearinghouse 2 that takes effect on November 18th later this year. Thank you again for UC San Diego for this partnership in promoting roadway safety. And I'll hand it back over to you, Darren.
Well, thank you, Nick, and thank you for your remarks, and thank you again for the ongoing support that you give to the TREDS program and the great work that you're doing with CMV safety in California. Our next speaker is Devin Eakes. He's a program manager with the Federal Motor Carrier Safety Administration Drug and Alcohol Clearinghouse. He began his career with FMCSA in 2005, shortly after graduating from the College of Charleston. During his time with FMCSA, Devin has served as a safety investigator, an enforcement program specialist, and currently as the agency's clearinghouse program manager. Prior to serving in his current role, Devin was chairman of FMCSA's Drug and Alcohol Technical Advisory Group, a group of subject matter experts whose primary goal is to serve and educate stakeholders. In addition to a bachelor's degree with a focus in global logistics and intermodal transportation, Devin also holds an MBA from the University of South Carolina. Before Devin takes the stage here, I just want to let you know we'll be holding the panel and Q&A, so we'll wait until after both Devin and Dan have presented, and then we'll go into the Q&A period. So, Devin.
All right. Thank you, Darren. I wish we could stay on this headshot a little bit longer. It is not that old, but I blame the receding hair in large part on the last year and a half I've spent doing clearinghouse activity just because of how active it has been. So, thank you for that introduction, Darren. Obviously, the time we have today is much briefer than the entire summit we had earlier this year in person, but I would like to start with doing a brief overview of, well, somewhat comparing and contrasting some of the data that I've shared with you all in San Diego. For those of you who maybe were not present for the summit, all of the stats that I'm going over are publicly available. We have them on our clearinghouse webpage. If you go to the Learn Center, there's a Learn icon in the top right-hand corner of our clearinghouse, all of our clearinghouse pages. Once you go to the Learning Center, if you scroll to the bottom, you'll see monthly reports that we've been putting out for a few years. So when we were at the summit in person, the latest public data that we had available was through 2023. As of today, the latest public data we have is through July 1. So what we can really look at now is the first half of this calendar year and kind of see in what direction we're going and see how that compares to prior year's data. One thing I want to stress as well, this slide breaks down, it's kind of a general breakdown that we do of the types of violations we receive into the positive test results. Those are the largest light blue portions of the columns. The drug test refusals, which are the mid-tier, I guess, blue columns, and then the smallest portion, which are actual knowledge. And so just to give a quick example of what those represent, actual knowledge are going to be things where an employer observes somebody using alcohol on the job or in any controlled substance use situation. It's also going to be situations where a driver admits to an employer that they have either used alcohol while in a safety sensitive function or that they've used controlled substances. The drug test refusals, while there are a few situations, really just 3, where the medical review officer, that's the board certified doctor that reviews the drug test results. There are 3 situations where MROs will report refusals, but those pale in comparison to the drug test refusals that are reported by employers. So when we're talking about drug test refusals, and they take on a lot of different specifics, but generally speaking, that's where an employer who has oversight over a CDL driver to send them for a DOT required test says, go take a test, and the driver does not comply in some manner. And so the positive test results, coming back to those, by and large, by far, the largest number of violations that get reported to the clearinghouse. One point of distinction I want to make with these positive test results, especially going back to Darren's opening comments regarding impairment, is that these positive test results only account for a driver's result if the driver is unable to provide that MRO, that medical review officer, a valid prescription to explain the lab result. We'll go into the substances that we test for in just a moment. But what this does not account for is, and we see this quite frequently, that a laboratory result for a test, including post-accident tests, will come back as positive. Often they're positive for things that you would find prescription drugs regularly issued for, your opioids, your amphetamines. If the driver is able to provide the MRO a valid prescription that was issued to them to explain that laboratory result, then the MRO will either report that result out as negative, or if the driver doesn't provide it in time, and the MRO reports it as a positive to the clearinghouse, the MRO will later be able to change that result to a negative, which means we will then remove it from the clearinghouse. So I just want to make that distinction early on. So what do we see here compared to where we were looking at things earlier this year? Currently, looking at the first half of 2024, we are on track to have a fewer number of violations reported this year in the clearinghouse than the prior year. It does turn out to be that way, and this is again just looking at the first 6 months of data. This would be the first time since the clearinghouse took effect in 2020 that we would see a decline from one year to the next for total violations reported. There's a variety of reasons for that we could speculate on, but I'm not the one to do that. So, but just wanted to point that out. We are, and this will bear out in the next slides that we'll see, despite what appears to be a slight decline in the number of tests being reported this year, we are still receiving more new violations reported compared to the number of drivers that are completing the return to duty process. So another way to think of that is the number of prohibited drivers in the clearinghouse is still increasing month over month. So this is a slide I mentioned that we would talk about the substances that we test for. These are not unique to FMCSA. This DOT tests are uniform across all modes of transportation. So your airline pilots, your rail operators, and others all submit to the same test. It's all tested for the same substances at the same levels. When we're looking at this chart, a few things to point out. I've talked about the MRO's requirement to adhere to and give recognition to any prescription medications the driver may be taking. Of the substances we test for that are shown on the screen now, only the one listed at the very top, which is probably not a surprise to anybody, that's marijuana, and the 2 listed at the very bottom, so MDMA and MDA, and that's essentially ecstasy. Those are the only substances that we test for that are currently Schedule I drugs, which means that there is no, federally, there is no recognized medicinal use for them. So if somebody has a laboratory positive for any of those substances, there's no consideration for the MRO to review a prescription medication. There are a couple synthetic marijuana drugs that are FDA approved, but the MROs are able to order additional tests to parse out the difference between organic marijuana and the synthetics. What we're seeing here, we are similar to in previous years. Marijuana is accounting for the majority of the positive test results. Again, not a surprise to anyone, including us. Marijuana continues to hold around 60% of those positive test results as a whole that are being reported to us. But taking the other view of that, that still means that 40%, which is not a insignificant number of the positive test results that we're receiving, are coming from those other substances we're testing for. And then the last slide we're going to have time for today on data and trends. Again, this slide is showing where we were as of July 1st. So when we previously met in person and we were looking just at 2023, what has changed? Well, at the end of 2023, that top number there, all drivers with at least one violation, was approximately 158,000. You'll see that it's risen. Excuse me, take that back. I'm sorry. The next block down, the light blue block, CDL holders and prohibited status. Sorry. At the time we met earlier this year, or at the end of 2023, there were approximately 158,000 drivers that were in prohibited status. So you go in prohibited status when a violation is reported against you. You move out of prohibited status once you complete the return to duty process. So that helps to demonstrate what I shared earlier, that we're continuing to have more drivers reported with violations than we are drivers that complete the return to duty process. One thing I did want to stress, going back to the top number, is that this includes drivers with at least one violation, as it's plainly listed there. I just want to stress that point because we do have a number of drivers that have multiple violations. So that's not captured in that figure there. At the end of 2023, we had at the end of 2023, yes, we had 120,000 drivers that had not started the return to duty process. So you'll see it's increased now an additional 12,000 just in the first 6 months of this year. And then for drivers who have had a violation reported against them, at the end of 2023, we had 68,000 that had completed the return to duty process and were no longer prohibited. So that's the green box at the bottom. That's where we want drivers to move toward. And you'll see that we've added about 12,000 in the first 6 months of this calendar year. So I do really want to stress the Clearinghouse 2 final rule. Here's all the specifics. I'm going to run through this slide fairly quickly. If you want to find information about this, you can find it quicker by typing FMCSA Clearinghouse 2 final rule in Google than you would being able to copy down the URL on the screen. But in short, what we saw early on when the Clearinghouse was first implemented in 2020 was a need to expand the requirements for when action was going to be taken against a driver's commercial license. So that's what brought about the Clearinghouse 2 final rule. It was finalized at the end of 2021, and it had a 3-year period before the compliance date. And so that's what brings us back to, as Nick already mentioned, the compliance date of November 18th of this year. So coming up very soon. This is a good slide to show you what those requirements that we are placing on the state driver's licensing agencies. That's what a SDLA is. In California, I know it's the California DMV. In some states, it is not the DMV. And so that's why we have to just adopt this generic term. But these are the requirements that we're placing on those SDLAs. So it's two components. It's the mandatory downgrade requirement and the non-issuance. That mandatory downgrade requirement, and you'll see some specifics on the screen, but the SDLAs are required to get information from the clearinghouse at least daily. And when they receive that information, they then have 60 days to act on it. So if they find out today that a driver is prohibited, then the SDLA has up to 60 days to remove that driver's commercial driving privilege if that driver is still in the prohibited status at that time. The non-issuance helps to cover that 60-day window. in that 60-day window, if the driver comes in for a commercial licensing transaction, so they want to renew their license, or they want to add an endorsement, or they want to remove a restriction, any of those would require them to query the clearinghouse. And if they're within that 60-day period and they haven't yet been downgraded, the SDLA is then to deny whatever action they have come in and that they are requesting. This is just another graphic that's kind of driving home even more so the point that we just mentioned. So we are currently still in the pre-compliance date. We do have a number of states that are currently voluntarily complying with this requirement, with the downgrade requirement. California, I don't believe, is one of them yet, but they could choose to do so anytime before November 18th. As of November 18th, all states are going to be required to comply with those two requirements I just mentioned. And one thing I really want to drive home on this slide is the bold text that's listed there at the bottom under the compliance date portion right in the middle. This is going to be a huge lift for many states as we approach and as November 18th comes, because they will be required to take action on all the prohibited drivers in their jurisdiction listed in the clearinghouse. And based on the numbers we just showed, that's 5 years, almost 5 years worth of data that they're going to be acting on. Now, going forward, it'll be much easier for them to maintain because they'll simply be acting on what comes in within that 60-day period. But this is going to be it's a significant requirement that is being placed on the states now, and it's also in turn going to have a significant impact on some in the industry that may be prohibited now and for some reason are still operating on the roads because their CDL privileges haven't been taken down, even if they are prohibited in the clearinghouse. So lastly, I just want to finish with talking about that return to duty process, because that's what we want drivers to do. If they are reported to the clearinghouse with a violation, we then want them, certainly if they are choosing to remain in a commercial driving capacity, to complete that return to duty process, stay free of any future violations, and then return to their driving responsibilities. And so this slide just is one representation of what the return to duty process is, but it's essentially visiting with a substance abuse professional, a SAP. After that first visit, that first evaluation, the SAP will prescribe education and or treatment requirements. Then the driver goes back to the SAP a second time. If the SAP is satisfied that the driver has complied with whatever they mandated, then the SAP will release the driver for a return to duty test. And then the driver will then need to find someone to sponsor them for that return to duty test. If that return to duty test comes back with a negative result, once that's reported to the clearinghouse, then that driver is no longer prohibited. And for those of you who have visited the clearinghouse and viewed some of our materials, this schematic is probably very familiar to you. This just breaks down into a more basic view of those steps that I just laid out. And until that negative return to duty test occurs and gets reported to the clearinghouse, which is step 5, that driver is still in the red, they're still in the prohibited status. One other component of going through the return to duty process is there are also follow-up testing requirements. The obligation to ensure that the follow-up testing requirements are met is actually an employer obligation. So the driver doesn't need to be concerned with that, other than whenever the employer says go for follow-up tests, that the driver goes, complies. As long as they keep coming back negative, it doesn't impact the driver's ability to operate, and they will just continue to function as any of your other drivers. So, lastly, I just want to spend a couple seconds on this slide. If you don't have it, these are ways to reach us. Again, the easiest way is probably going to be just to go to the clearinghouse webpage. We have icons for the Learning Center, as I already mentioned, and we also have a contact us page where you can get this and more information as well. So thank you all for the time this morning. This morning, yes, let's say that correctly. I'm East Coast, so it's afternoon for me, but I'll turn things back over to Darren.
Thank you very much, Devin, and a lot of information. I know it's a lot to take in, and if you have some questions or anything, please put those in the Q&A box, because I know that there'll probably be some things there for you, Devin, as we circle back to that after. So next, I'd like to introduce Dan Horvath. Senior Vice President of Regulatory Affairs and Safety Policies at the American Trucking Associations. Dan Horvath is the Senior Vice President of Regulatory Affairs and Safety Policy at the ATA. Dan joined ATA in March of 2018 as Director of Safety Policy after more than 5 years as Director of Compliance and Safety at Transforce Incorporated. Prior to that role, Dan was a Federal Motor Carrier Safety Administration auditor, examining new commercial carriers for regulatory compliance. And before his time at FMCSA, Dan spent several years as a driver and in the Operations and Safety Department. And I don't know how to pronounce that. You'll have to help me out, Dan. Malacker?
It's Malacker. Yeah, that's good. Trust me, nobody knows how to pronounce it. So
Malacker Transportation Incorporated. In this role, he represents ATA and its regulatory affairs agenda before federal and state government regulators and various non-governmental organizations. Dan directly oversees the association's safety policy committees, which formulate the official state or safety policy agenda on behalf of ATA's broader membership. Dan, a proud CDL holder, is a 2017 graduate of the LEAD ATA program. Congratulations. A longtime volunteer at the National Truck Driving Championships and serves on multiple federal advisory committees, including FMCSA's Motor Carrier Safety Advisory Committee. I'll turn the time to you, Dan.
thank you, Darren, and good to be back and talking with everybody. What I'll try to do in the next 10, 15 minutes or so is really focus on this marijuana reclassification issue. And my colleague at FMCSA did a great job kind of transitioning into some of this and what it impacts, or what impacts rather it's going to have on our industry. So as my long bio, which reminds me, I've got to shorten that thing. It's just entirely too long. But as my bio has alluded to, I oversee regulatory affairs on behalf of the American Trucking Associations. So we work with our partners with our state associations, including California Trucking Association, but as well as have regular liaisons with Federal Motor Carrier Safety Administration and other DOT entities. So this has been a big one that me and my team have been spending a lot of time here lately. And, you likely have heard about this. And I want to give some perspectives of why we're a little concerned about this within our industry. So earlier this year, the DEA on May 22nd announced that they were publishing a notice of proposed rulemaking proposing to reschedule marijuana from a Schedule 1 to a Schedule 3. And actually, from all accounts, it was a media leak of some sort, or rather a media report that had indicated this was forthcoming. So we got a little antsy at ATA, and I think rightfully so, because of initial concerns of what would a rescheduling from a 1 to a 3 do to DOT's ability to test for marijuana. Schedule 3 substances are recognized as those with lower risk, and also have some legitimate medical use. But the question is, would DOT still be able to test for those drugs going forward? So prior to that release, we, within ATA got together and says, we're going to err on the side of caution with this. And we sent a letter to the Department of Justice, DEA, and then also Health and Human Services, HHS. And why that matters is DOT, while they establish their whole, their regulatory process, their rulemakings that impact truck and bus industry, and they have the Part 40 regulations, which impact drug and alcohol testing across all of the modes. There are certain things that the DOT has no control of, including, for all intents and purposes, the drug and alcohol testing panel, as Devin went through earlier, which was a great kind of segue into this. So we were concerned that if it was rescheduled from a 1 to a 3, DOT wouldn't have the ability to test for it, even if they wanted to going forward. So we set this letter off, and then we had drafted another letter on June 20th, June 28th, directly to Secretary Buttigieg, essentially saying we are requesting a response from the Department of Transportation on what a rescheduling would do for DOT testing purposes. We're a little less concerned now based on some comments from the Secretary during a hearing on this topic. But why this matters to us is we truly believe that absent an impairment standard in our industry, we're going to have an increase in highway fatalities, highway injuries, and highway crashes if we go down the path of an all-out rescheduling and eventual legalization across the country. And there's a lot that goes into that. And trust me, I don't take it lightly when I make comments like that. But from my perspective at the American Trucking Association, at the end of the day, we care about highway safety. We care about the impacts to our industry. So we made that clear in the letters that we sent regarding this matter. Now, make no mistake, and I've been chastised a few times on this so far. Let me go back a slide here. ATA does not have a position on nationwide marijuana legalization. What we care about specifically, to make clear, is the ability for anybody operating a commercial motor vehicle to still be subjected to drug and alcohol testing, including having marijuana in that panel. We're not at the point where we have an impairment standard. We might get there one day. I'm told by a lot of our folks that it's much more complicated than impairment standards that we have for alcohol, for instance. So until we have a reliable impairment standard, we want to make sure that our employers can continue testing just as they do today. And I do think, with regards to the impacts of marijuana, we hear all the time that, hey, trucking's old school. Why are we still testing for marijuana? It's not that big of a drug. If it's legal in states, drivers should be able to use it. And some of those arguments are very valid. But what we don't talk about enough of is the highway safety impact. And that is something that, we have filed in our comments in response to this proposal we submitted on July 22nd, really focusing on not whether there should be a rescheduling from a 1 to a 3, but unintended consequences and outcomes of not only regulated safety sensitive transportation workers, but the entire national transportation system. And this was one of the rare times where ATA and several safety groups were able to get together and say, we all agree on this. We are on the singing from the same tune here. We need to make sure that we're preserving, we're not going to have unintended consequences with regards to highway safety. So that docket for the DEA received over 43,000 comments, which is just quite remarkable. A lot of different opinions on there. A lot of folks, that have said, if it's legal in my state, why can't I do it, regardless of what I do? But among those, and this is an interesting point that I want to make here, that unfortunately, I think we're going to start seeing a trend going forward, is the National Transportation Safety Board actually filed comments highlighting the concerns to highway safety. And about the same time here recently, NTSB released a crash report where they actually cited marijuana impairment as a contributing factor. And that's pretty substantial of a point, because, the NTSB over the years, while they've cited marijuana as being in the system of those that were tested, this is one of the rare times where it's actually been cited as a contributing circumstance in a crash. And unfortunately, I think we're going to see more of that. So the question ought not to be whether legalization should happen or not, or whether DOT safety sensitive employers should be tested. It should be about the broader conversation of legalization and the impact of highway safety, and ensuring we keep those protocols in place to continue testing. So this was a chart I believe I showed when we did this live at the beginning of the year of where we're at with state level marijuana legalization. 25 states fully legal, 20 states are a mixed status, and then 6 states only are fully illegal. Decriminalized 32 states, medicinal use 45. So really, as I say, it's not a matter of if, but when it comes to legalization across the country. Another interesting point I want to point out is the impacts directly within the trucking industry. And this was a research report our research associates at ATRI conducted, where they interviewed truck drivers, they interviewed folks from the trucking industry, and asked a series of questions related to marijuana legalization. And I kind of highlight a few interesting takeaways here. And even if you're in the bus industry, I think a lot of this applies as well. 43.7% of carriers were not willing to rehire or hire a driver after a past positive test. And that number to me is somewhat low. I think if we would ask this question 10 years ago or a little longer, that number would have been much higher, because there were a number of motor carriers over the years that had zero tolerance policies for rehiring as somebody who's had a previous positive. Now, with the driver shortage and all the issues that go into with it, I think folks are starting to rethink those zero tolerance policies. I'm going to skip down to the last two bullet points because these, to me, are really the concerning ones as we talk about highway safety. 55.4% indicated believing highway safety is not impacted by marijuana legalization, saying, we don't think highway safety is impacted by it. So that's concerning. But the other big one there is 19% of CMV drivers were unsure if marijuana use was allowed in the state where it was legalized. And that's concerning, and really, goes into what Devin talked about earlier, is that we have an increase in the number of positives that are in the clearinghouse, or rather violations total that are in the clearinghouse. I'm not going to go over these all again because he covered them earlier, but certainly with the misinformation that's been out there regarding marijuana use, I really do believe drivers when I hear them say that, hey, I didn't know what I could or could not do, and there's just a lot of bad information. So what I do think, and just to drive this point home with the Drug and Alcohol Clearinghouse, is with the number of positives decreasing, but the overall violations increasing, and violations, being the refusals, the clearinghouse is working. So hats off to FMCSA and to their partners that were working on this for many, many years, and getting this done and closing one of the major loopholes that existed. So very briefly, as I kind of transition out here, I did want to cover just a couple of other things ATA is working on from this standpoint. We have been pushing for oral fluids testing for a number of years. We think oral fluids testing is going to make a significant difference in the ability to identify drug users in our industry. It will, in my opinion, lead to an increase in the number of positives in the clearinghouse. And that's not necessarily going to be because oral fluids has a longer detection window. It's actually shorter than urinalysis. It's going to be because of one primary factor, and that's every oral fluids test is essentially an observed collection. So think of it today when an individual goes in for urinalysis, unless it meets certain circumstances, it's not an observed collection. Oral fluids is a different story. It's going to be observed collections. So we'll see an increase with that. The other thing we're monitoring closely is that the Health and Human Services Department is discussing adding fentanyl to the panel, and then also removing MDMA and MDA, which is ecstasy. We support the addition of fentanyl. We do not support the removal of ecstasy, even though those numbers are fairly low, as my colleagues pointed out earlier, as Devin pointed out earlier. We believe it should remain on there. And then last but not least, is it was highlighted, the final kind of push, in my opinion, to ensure that the gaps are closed in the process with the downgrade process. So we think this is all great step. This is kind of a timeline I always like to show of what has happened from DOT as far as closing any gaps that have existed in the drug and alcohol testing process. And we're fortunate that they've done that. The last side that I'll end on is I do think, from my perspective, that there is still more to be done. This is, to make clear, not a DOT thing. This is waiting on Health and Human Services to quite frankly get the job done when it comes to hair testing. We truly believe that hair testing will be a game changer in the industry. We receive on a regular basis a number of our motor carrier members that will show us that they've had a driver test positive for the hair test, that they've tested negative for that urinalysis, and they can't report it. They don't have to hire the driver. They don't report the driver, but that driver often goes and gets a job somewhere else. So that's critical, and we think that's the final kind of point in getting this all done, is getting hair testing across the finish line. And I'll end on the point that was made by Darren at the start. And Darren, I think it was a great point that I'm a safety guy. I have a safety background with what I've done at ATA for years, and I feel bad talking about drug using and alcohol use and abuse and drivers that are grouped into that category. And by no means do I paint the picture of this being the entire industry, but unfortunately, it is a segment of the industry, and it's why we have rules and regulations and why we work to put improvements and processes in place to make that better. So I'll stop talking, but look forward to any questions we have here in the end. And Darren, I will turn it back to you, sir.
Thank you, Dan, and great information, kind of the concerns, I think things that are coming up and how will this impact the industry. I love the ideas of the oral fluid testing pieces. We've been trying to use that a lot, just even roadside as even part of as a deterrence and factor as well. And then to see some of the other things with hair testing and that. So thank you very much for your comments. And I look forward to some of the questions that we have in here. So if we could go to, let me ask you this question really quick. We're going to go to the Q&A panel. Now we have a couple of questions that are in the box, and then I have a few questions that came in from the pre-event emails that were sent out. And so we'll kind of mix and match a couple of those. And one of them actually, I think here is, this first question is, would you say that a reason for an increase in drivers not participating in a SAP RTD reprogram is due to many motor carriers not considering them for employment for months, years after the violation and program was completed? I think, Dan, you mentioned that. But Dan, Devin, if you wanted to just talk about that just for a second.
Yeah, Darren, I did. I'm happy to start and hear what others have to say. I absolutely, that's a factor. As I kind of alluded to, I think that is better. My experience over the years was carriers would not even consider you for hire at all if you had a positive drug test, even if it was 10 years ago. I think we're starting to see somewhat a loosening of the regs. The part that goes along with it is or not the loosening of the regs, but loosening in the standard. Part of what goes into that, though, and this is really unfortunate, is that even the carriers that want to consider hiring a driver who's had a positive violation are more reluctant to, with the litigious society that we live into, that knowing that if, God forbid, something were to happen with that driver later down the road, this is just one more thing the trial attorneys are going to use against them in a court of law and say that you should have never hired that driver in the first place. It's really disappointing, because I do think there are many cases out there where it was a mistake that an individual made years back. They've gone through the process to come back, but are reluctant to get hired because of everything that goes on. And that's at least my take of it.
One thing I would just kind of add, this doesn't answer the question because I think Dan is much better positioned to respond to that question than I am. But one thing just to make everyone aware of is that it's much easier to go through the return to duty process in our current environment than it was just a few years ago. And really for two things. The clearinghouse, as you would expect, has significantly increased the number of SAPs out there. That doesn't mean all of them are great, but it's significantly increased the number of substance abuse professionals. They saw an opportunity in that the clearinghouse is now requiring many drivers that otherwise would have just flown under the radar of having a prior violation. The clearinghouse is now requiring them to address it by completing the return to duty process. So it's put a higher demand on the number of SAPs, and so there are many more SAPs out there. So drivers can get, 10 years ago, I would hear from people saying, well, I can't get seen for 2 or 3 weeks. That's not the case now. And then one other thing, ODAPC, we haven't mentioned them, but that's the Office of Drug and Alcohol Policy and Compliance. Dan has mentioned Part 40. They control Part 40, which covers all of DOT. They actually, initially, it was an emergency provision with COVID, and they have now made it permanent. They now allow those SAP evaluations that I referred to take place remotely. You do have to have video and audio technology, but previously they had to take place physically in person, and now they can take place remotely.
One thing, Devin, is, and you kind of made me think of this, that we've heard from a few of our members as well, is that say a driver tests positive and the carrier terminates that driver, which often is the case, that the driver, and as it stands for the process, is unable to actually take the return to duty test unless they have a motor carrier arranging that for him or her. And we've been told that is a hurdle at times, where if I walk into a carrier and say, here, I've gone to return to duty, I've done everything I need to do, hire me, they're more receptive to that versus if I go and say, oh, I need to go in for a return to duty test and that type of thing.
Yeah, and that's a great point you bring up, and we get that quite a lot. So just quickly to address that, if a driver having that issue, they can reach out to us directly. We do have guidance that will make available for them to complete the return to duty process.
Oh, great.
But
great.
In short, they need to do just what an owner operator would, which is to designate a third party to report that information on their behalf, just to a third party to hold them accountable to make sure the test was done correctly. So.
Good to know.
So another question that came in from some of the pre-event emails is, what can I say to a driver who refuses to go for a drug test because he repeatedly he's called to take the drug test?
The only thing I would caveat with this, and then I'll turn it over to Dan, is if an employer is sending somebody, and we can come back to this, but if an employer is sending a person for anything but a pre-employment test, and under DOT regs, they have standing to send them for the post-accident, the reasonable suspicion, or whatever the case may be, then the driver does not have a choice in the matter.
Darren, I kind of laughed when you said that. So I got my CDL when I was in college. So I was an 18-year-old in college with a CDL, and I got picked for a random, I swear, every month. And I remember saying to my company at the time, like, you're telling me this is random, you're picking on the college kid. But it was, I mean, it was truly random, and I had to go in. So I would agree with Devin. I mean, I'm sorry that you need to go, whether you agree or not. The circumstance, I think some of the takeaways that I've said to motor carriers working with over the time are that far too often, and I think this is why we've seen that increase in violations in the clearinghouse, is far too often drivers get upset and they say, well, I quit. I'm not taking the test, and don't know the impacts of this being the same as testing positive. So as an employer, we're really obligated to make sure that they truly understand that. I mean, I remember telling a driver years ago once, when we did a reasonable suspicion for drug use, that you were almost better off going in and hoping something happened in the testing process and you passed the test or it wasn't detectable than flat out refusing, because there's a 0 chance when you refuse.
And I guess part of it, and Nick, please feel free to open your camera, and if you have any comments, as well, please feel free to jump in. One of the, I guess one of the responses, well, if you didn't have bad luck, you wouldn't have any luck at all. So I don't know if you had any response to that one, Nick, or not.
I would leave it up to the experts here. Dan and Devin provide some very good feedback, but kind of just both to their points, it's, they don't really have a choice in the matter that they are, if they refuse, then they're going to be in a much worse situation.
Yeah. So here's another question, is if a driver gives a positive drug test result and his employment is terminated, who orders the return to duty test?
I can just speak to that real quickly. We kind of touched on that with the scenario, well, with the questions that Dan mentioned that come into him and the ATA fairly regularly. Per the regulations, the return to duty test should always be entered by an employer. And so in this case, it's generally a prospective employer. What our regulations say is, if a prospective employer sends somebody for a return to duty test, and it could be contingent on a number of things, not just the test result, but maybe they haven't offered them a compensation package or whatever the case may be. if that prospective employer sends a driver for the return to duty test, even if they don't hire the driver, the employer is still required to report the negative return to duty test result to the clearinghouse. There is in the regulations an option for self-employed, or in our industry, often referred to as owner-operators, to get a third party to report that negative result on their behalf. And we have that available for drivers that don't currently have an employer or a prospective employer, but they're trying to at least get the prohibition lifted.
Okay. Did Devin nail that answer?
Yeah.
Okay, perfect. We're going to do one more, and this is kind of a scenario base that came in, and this was one of those pre-event email questions that had come in. Is you have a potential employee and you give them the next available appointment for a physical and drug screen, which is the following day. They leave your office and attend another interview that afternoon, or are offered a job and sent to a physical and drug screen that afternoon. They do not call you and decline your offer and do not show for the physical. By law, we are supposed to report this to the clearinghouse as a no-show, which is considered a positive. However, they did pass the screening they did for the other employer. Will this put a hold and also suspend their CDL and break it down to a Class C license without driver even being aware that this has happened?
If I can make one clarifying point there, and this, I'm glad you asked this question, because this goes back to when I made that little caveat about sending somebody and except for a pre-employment test. So this question talked about making an offer. I assume that it is in a pre-employment situation, because that's when you're most often going to see a DOT required test and the DOT physical happen at the same time. If you look in the regulations where it talks about a refusal to submit, that's defined in 382.107 of our regulations. Refusing to go for a drug test when directed is a refusal, except in cases of a pre-employment test. It even refers to their a section under that Part 40 that we talked about. Just for those who are taking notes, it's 40.63A. But without getting into the weeds of the regulations, if that person at any point, even if they have showed up and they're in the waiting room at the collection facility, if they leave before the test commences, before the collection container has been selected, then it's not a refusal.
Okay. Any other response?
No, I
Nick?
mean the experts, the regulatory experts nailed that, Devin. I know we had we got a little vocal when there was the floating proposal a few months back to potentially change that on a pre-employment side, and I said, well, wait a minute, in the trucking industry, this is pretty common that drivers apply for a job, they're sent for the pre-employment, and they see the billboard down the street that they're going to make a few bucks more somewhere else, so they go to that company, not to blame them in any way, shape, or form. So I think that's pretty frequent in our industry. So glad to know that's still in place.
All right. Well, thank you very much. We're going to move from the Q&A portion of our webinar to kind of an open discussion. And this is really to kind of what are the most pressing issues faced by fleets as it relates to substance use and impairment within the commercial vehicle industry. I am not sure if it's just going to be in the chat or if we're going to actually have you all unmuted to raise your hand. So my first question for all of you is, what are the most pressing issues fleets are facing related to substance use and impairment? You do have the option to raise your hand, and then we'll unmute you if you wanted to speak. Anyone? Anyone?
Darren, I mean, if you want my side of it, maybe someone can chime in.
Mhm.
We have a growing workforce shortage. This isn't gonna, that's not getting any better with what we have going on. So to me, that's one of the most growing concerns. Um, you know, that we're going to run out of folks that want to do the job that we need them to do.
Right. Yeah, the shortage of drivers and everything, and then to see the number of people that are in that kind of process, that almost that no man's land in some cases, where they've are trying to return to duty and there's a pull-out process and that. So is, that's a huge issue for carriers. I mean, how many of you, I guess, for some comments out there, is being able to look at the training for your fleet managers, safety managers, identifying this, is that a significant challenge for you, or do you feel like you've got a hold on some of that, or are you looking for how you can improve that training for your fleet managers? Again, you can raise your hand at the bottom there and we'll unmute you. I guess another question I could ask you is, what strategies have you taken to address substance use and promote compliance within your company?
Darren, it looks like we have a hand raised from Jessica.
All right, Jessica.
And Jessica, we've unmuted you. So I think it might ask you to unmute.
Can you hear me?
Yes,
Yes.
perfect.
Hi, Darren. It's good to see your face and everybody else. We function a little differently in our industry, but one way I feel that we promote it best is follow through and communication. So, making sure the communication is out there prior to any violations, that they understand our company's expectations, just overall about drug and alcohol, and then assisting them through the return to duty process if we're going to be hiring them, so that they understand it, because I feel a lot of drivers go into it blindly and don't understand really the process and what they're doing. And then also making sure that we stick to our policy if there's any violations, or if they're not following protocols and procedures, that we are following. We're being a beacon ourselves as a company and following through.
Do you find that the drivers and those feel like there's more of a support system than just kind of I guess once it's done, you're gone?
I do. It depends regionally across the US too. In certain areas, not as much, but overall, I do feel that they understand that the support is there and the encouragement is there, and that we do want to retain them as drivers. Even with, and I apologize if I'm quoting it wrong, but is it 40.237 with their medical card if they get flagged? Even that process can be very confusing, and the drivers get scared and they don't want to go see their physician or respond to the MRO. And it's our encouragement, like, look, we really want to hire you, and the only way we can is to have you follow through with this process. So let us help you.
Okay. Excellent. So you've shared something that's working for you. What do you find you struggle with, or what isn't working that you'd like to see, maybe a process improvement, or maybe educational materials that could help?
I feel where it's lacking every single time is really with refusals, more than anything else. Their understanding of leaving the clinic, what a refusal actually is. There's just different understandings. And And it doesn't, it seems like no matter how much we educate or tell them, you know, to follow through with the process, plus if you have any concerns, don't leave the clinic. They, some, not all, some are truly refusing, but others just get really frustrated with the misunderstanding of what, that they received a refusal based on their actions, because they don't understand how that qualified as a refusal, and that's just really difficult, and it's just education and really getting it out there, and making sure that it's not just the companies, but the clinics are also, you know, providing that education too.
Yeah, and do you find that that there's not enough information about that or easy resources to share with them, or is that something that you could see potentially maybe Tread's helping with, or other groups working together to help provide some of that, maybe kind of like a it's like a schematic, like if this happens, this is what you do, if this happens, this is what you do.
Absolutely. I mean, I feel any simplified visuals and having the information out, not just by the employer, but even if it's, you know, licensing agencies or the clinics or somebody like that, that it would be very hopeful. And I think we would see a lot less positives due to refusals. At least that's my opinion.
Okay, that's something we could definitely take a look at. You know, one of the things too, I just wanted to kind of circle back to the summit in March, is we actually had you complete some action plans and some strategies and ideas of what you could go back and implement. And there was one that came up, and Rodney, if you wouldn't mind sharing a little bit about what you experienced, and then if you had some other comments too that you'd like to, I'll let you have the mic for a minute.
All right. Thanks, Darren. Can you hear me?
Yep.
Okay, good. Just want to first say, you know, appreciate all the work you guys, the whole organization and all this together has done, because it is very informative and it does help. One of my action plan that we had put together was, we have trainers here in our organization that once they go through our orientation class and training, they spend a week with a driver learning the different customers and that day-to-day operations. Well, those are the first people besides myself that sees these drivers that come into the company. They're the next people that get to see them and how they interact on their day-to-day basis. So what a great place to be able to implement a reasonable suspicion training, because they're going to spend the next week with them. I see them in a classroom for 3 days, and you know, that could be a different they get to see them in a different light. Let's just put it that way. So we do have a training meeting that we do an annual train the trainer. And my ideas, and we are working through some other issues on that just to make sure we're in the legal aspect, because we are in the state of California, but training our driver trainers to be able to be under that reason, to do the reasonable suspicion training, be certified in that, so that they can also be part of that input on how that driver acted out there for the next week. And then that also gives them a responsibility. They do, our driver trainers are, they build this program. So they're and so that kind of gives them an ownership of it, and also lets them feel a little more valued in it. And that's where we're hitting. That'll take place here in February.
Outstanding. And just so everybody knows, you know, we have provided at the summit kind of a little worksheet to kind of walk through kind of these action plans. And I think you completed an amazing one, and and you shared that at the summit. But just for those that may not have been there, I think Renee and team, you'll be able to resend those out to them as a follow-up email, and it's just going to give you more work. to do. But this is really a good step. And I think, Rodney, you and your team really from different areas in the organization had some conversations and looking at how you work together on that.
Yes, and there's other, like you had brought up fleet managers, dispatch, we have that. We also have field services that are out there working along with this, and all this is going to work together to create this environment, and like I said, put us up another notch.
Absolutely. Well, you know, and I wish you the best of luck, and hopefully you can get over that little barrier that you're working through. But that was one of the questions: is what kind of barriers do you have that you need to work through? And so, so thank you very much, Rodney, for taking the time to share some of those thoughts, because you know, working together in your own organization with others, I think, is a key element to some of the success.
Oh, you bet it is.
So, you know, as we kind of wrap up this little open discussion here, one of the questions that I will just pose to you, but, you know, you don't necessarily have to answer, but, you know, from the challenges, some of the issues that you're facing is how can TREDS help you? And, you know, with the funding they get through FMCSA, the research that they're doing, the resources that they kind of look at and looking at some of those priorities, how can TREDS help you? So think about that as you are kind of working through some of these and some of the challenges. I mean, you've got a lot of great resources within California to help you, but again, how can TREDS help you? So we are right on time with everything, and I would like to now transition to our next portion, which is with Renee on the Just Drive Delivered Drug-Free curriculum.
Thank you, Darren. And one thing I want to add, Darren had mentioned the action plan form that our summit attendees were able to utilize during the event. And so it's a really excellent form that allows you to really think through a feasible action plan that you can implement within your company. So we would be more than happy to share that out with everyone today. We'll add a link to our website, but we'll also share it out as a PDF in your follow-up email. So just keep an eye out for that, and we hope that it serves as a useful resource for you all. So now I'm going to be talking about our Just Drive Deliver Drug-Free educational program, which we recently developed and we launched at the summit. Some of you may already be familiar with this program if you did attend the summit back in March, or if you attended our Train the Trainer webinar that we co-hosted with the California Truck Association back in July. But for those who are hearing about this program for the first time, I would like to share some information about this program, which specifically addresses substance use within the CMV industry. I'm going to be showing a trailer that really highlights the key components of this course. So I'm going to move on to the next slide, and you will have the opportunity to view this trailer.
Commercial motor vehicles, CMVs, are crucial to our economy. However, their size, weight, and limited maneuverability increase the likelihood of severe injuries and fatalities in crashes. These dangers are significantly amplified when the vehicle is driven by someone under the influence. An alarming rise in positive drug tests among CMV drivers underscores the urgent need for specialized training on the dangers and consequences of driving impaired. With funding from the Federal Motor Carrier Safety Administration, FMCSA, UC San Diego Transportation Research and Education for Driving Safety, TREDS, developed the Just Drive Delivered Drug-Free course for commercial drivers, and it delivers. The course explores the scope of drug-impaired driving and factors contributing to drug use among CMV drivers. Drivers will gain a comprehensive understanding of the risks and consequences of driving impaired and ensure they are up to date on the current laws, regulations, and testing procedures. In addition, the course equips drivers with practical strategies to prevent drug-impaired driving. The 60-minute course features current data from the FMCSA Drug and Alcohol Clearinghouse, real-life examples of crashes resulting from drug-impaired drivers, and opportunities for drivers to reflect on their own behaviors behind the wheel. With the goal to help your drivers make safer decisions, this program is completely free to you and your team. Upon completion, drivers will receive a downloadable certificate to recognize their commitment to safer driving practices. Working together, we can make our roads safer for everyone. Bring the TREADS Just Drive Deliver Drug-Free course to your CMV drivers today.
So that was an overview of our training curriculum. So this program is currently offered in the Train the Trainer format, which includes a detailed modeling of the curriculum and a step-by-step guide for implementation. Upon completion of the training, instructors are going to receive a variety of materials to deliver the program directly to the communities they serve, which includes a 60-minute PowerPoint presentation available in both English and Spanish, case examples, learning activities, and a certificate of completion they can provide attendees. We also created a pre- and post-test survey to track effectiveness and participant satisfaction. And this Train the Trainer program can currently be requested live via webinar. But we're also in the process of launching an online Train the Trainer course, which will be available in the coming weeks. And that'll allow instructors to take the course in a self-paced fashion and then receive the certificate of completion. And then subsequently, they'll receive access to all of these materials. So if you are interested in either requesting a Train the Trainer, or if you'd like to be notified when the online Train the Trainer is available, here is the link and a QR code. So if you type this link or scan the QR code, it'll link you to this page on our website. And so you'll have more information of how to request the Train the Trainer, as well as a sign up to be notified when the online version is available. And now I will pass it back to Darren.
Well, thank you, Renee. And if you haven't seen this, that resource is phenomenal, and good resource you can share with your drivers, fleet managers, dispatchers, anybody that's operating in a safety-related function is tremendous. So as we wrap up today, we'd like to just ask you as participants if you would complete a brief exit survey. It takes less than a minute. About your experience today and some things that we can learn from your experience, and things that we can help you with, additional resources, maybe some key areas for training or information that we can support you with. So if you would just either click on the bit.ly link, or you can actually copy paste that, put in your link, or you can just use the QR code and then complete the survey. We'll give you just a minute to do that.
The link has also been dropped in the chat.
All right, hopefully you've all gotten your surveys completed. And as we conclude today's webinar, I just wanted to say thank you very much for the work that you're doing. the work that you do makes a difference in people's lives. We know that everything is, if it wasn't for the trucking industry, we wouldn't have goods delivered to our stores and so on and so forth. But I just wanted to say thank you for all that you're doing in your companies, looking and reviewing policies and procedures and providing training and refresher training and attending today's webinar, because there's a true importance for not only safety, the fleet safety managers, but company owners and the dispatch and anybody that's operating in the company is really having that culture of safety. It's one thing to say, yep, we believe in safety. It's another thing to actually practice that. And when you think about culture, it incorporates your attitudes, your values, and your beliefs. And coming together, that actually is what culture is. And so, as you continue to do this and focusing on addressing kind of the substance abuse impaired driver within your own fleets, but importantly is how do we reflect, the company values, the mission, all of those visions that you have, is in continuing to emphasize that safety piece of it. So thank you very much. Thank you to the University of California, San Diego TREADS program for all that you're doing to help to provide resources for the commercial vehicle industry, especially in California right now, and hopefully we can see that stretch out as well. In many cases, like fleet managers and that, you're the first line of defense. You have that opportunity to see, recognize, and intervene before something happens. So continue to do the good work. We'll continue to do this. We do have action plans that you're going to be seeing, but continue, I think, as far as companies is to get that call to action on this. With the prevalence of different drugs and psychoactive substances and the mixing and matching, I know there's so much out there, but continuing to promote that culture of safety and wellness within your company is essential. I know that we can't hear you, but I'd also like you to give a special round of applause and thanks to all of our panelists today. From Nick, Dan, Devin, thank you very much for your willingness, your resources, your expertise, and the continued efforts that you do every day to make our roads safer. And with that, thank you. And if you wanted to check some of the chat for some of those informations, but you'll also receive an email with some follow-up information. And with that, have a great rest of the day and stay safe.